Insulin. What is it? Insulin is a vital drug that diabetics like me need to survive. Insulin breaks down the glucose in the bloodstream, and my pancreas doesn't produce insulin like a normal person's would. Because of this, without insulin, a person could suffer vision loss, loss of limbs, or even death. Luckily, there is synthetic insulin. But there's one big problem. The synthetic insulin market is controlled by three big suppliers: Sanofi, Novo Nordisk, and Vegas Eli Lilly. These three companies have an oligopoly over the insulin market in the United States, which means that they can control the price. For many Americans and American diabetics, this is a huge problem, as it can make insulin extremely unaffordable, as one vial can cost pre-insurance up to $400.
Sure. My name is Matt Taro. I am 37 years of age, and I've been living with type 1 diabetes. Super fun to say out loud. For 21 years, been advocating pretty hard for diabetes patients, people living with diabetes, type 1, type 2, and then ultimately working with nonprofits. That's how William and I met through an organization represented here, riding on insulin. Yeah, I'm also in a unique position where I've traveled specifically to Mexico and to Canada from the United States to buy insulin. Got picked up by NBC Nightly News. There's us going into Mexico with Gotti Schwartz and a whole film crew and having conversations and walking around to different pharmacies.
$45. And then in the United States, this is $250. Wow. She just said that there are people that come all the way from Chicago because medicine is very expensive, and so they come here.
Drug companies explain the dramatic price difference is due to different healthcare systems, but these people aren't buying it.
And it makes me feel really good.
This makes me
feel like we're stealing from them, from the pharmaceuticals.
So this is you sticking it to the pharmaceutical.
And it feels great.
All in, the group spends less than $900 for one in the U.S. they say would cost more than $8,500. Insulin they need to survive at prices they can afford.
The vial of Humalog that I typically get roughly equates out to 300 US American dollars. In Mexico, it was under 40. It was 36. And in Canada, it was roughly the same. Yeah, this is the US. So this first one here is the US. This second one here is Canada. This is all three of them together. It is 100% the same. It is all Eli Lilly. Look at those right there. You see those bad boys? Mm-hmm. You do not need a prescription from a doctor in Mexico, and you do not need one in Canada. You do need one here in the United States. You quote me. To make up for the egregious sins of their board and the sins of their shareholders and the greedy individuals who have caused stress, death, and anguish across the United States, they would have to give insulin away for the next 100 years. And then even then, we'd have to say, right? Like, see, like you guys were screwing us all along. Like they're to blame, and we should hold them accountable.
Due to the amount of deaths, the amount of incidents related to lack of insulin, many Americans are calling for a government intervention. And that makes sense. This is America. There's no reason for people to be dying due to lack of treatment for an easily treatable illness. But why are people dying from an easily treatable illness? It's really money. That's what it boils down to.
Sure. So in the United States, unlike other countries, we have a private pay system which is supplemented by Medicare and Medicaid. And so unlike other countries like Sweden, Denmark, Norway, Finland, the United Kingdom that have nationalized healthcare, the United States is for the most part employer sponsored or purchased healthcare on exchanges. And so since the health insurers that are referred to as the payers are for-profit entities with a shareholder class they're required to generate a particular return to their shareholders. And so as a result, they have to generate a reasonably decent profit margin.
The United States is a free market and capitalistic system. These companies like Eli Lilly, they are part of the American economy. They have employees, they have shareholders, and they have a board who need to turn a profit for the shareholders. But due to the American healthcare system, this means that much of these costs are put on the consumer, and that's where we see this direct effect between company and consumer and the lack of care.
But most individuals in the U.S. tend to derive their healthcare from their employer, and so it takes a disproportionate share out of their earned income. And we have one of the most expensive healthcare systems in the world, the United States.
In the U.S., we have the insurance system. Most people's insurance system is provided by their employer. This is what cuts the cost for most of American diabetics.
I have type 1 diabetes. I was diagnosed when I was 21. Yeah, Eli Lilly is the manufacturer. They use Humalog, which is a Lispro fast-acting insulin. I don't pay anything per vial. It's completely covered by United Healthcare, which I got through my employer, Dismed.
The other interesting development in the pharmaceutical space is there's now a nonprofit drug manufacturing collaborative called Civica RX, which is made up of a collaborative of a number of major nonprofit health systems around the United States. Their mission is to effectively create a pass-through model to provide commonly prescribed drugs like insulin at cost to consumers.
It's the best thing that's happening right now in the United States, outside of the fact that there are lobbying efforts for insulin bills to be passed, and there are youth getting involved in writing those bills, signing those bills, advocating for them, lobbying on the floor for them, speaking. There's so much of that happening. It's so powerful. The best thing, though, that's happening currently in the United States is the fact that California currently is manufacturing their own insulin. And if anyone saw recently, Governor Gavin Newsom and the state of California actually shot down the $35 insulin cap bill. And the reason they shot it down is because soon enough, they're going to be able to produce it for less than what you would get it for there.
I do think that a real success of the last two presidential administrations, Biden and Trump, they've both worked to lower the out-of-pocket cost of insulin for those with health insurance, for those on Medicare, Medicaid, for those without any insurance.